Thank you. I represent over 400 not-for-profit and government long-term care providers across New York State. Although the governor acknowledges New York's growing older population and rising need for long-term care, her budget fails to make the investment to address the dire need. Not only does the budget proposal fail to invest in desperately needed funds to ensure access to care for older New Yorkers, it imposes significant cuts. Even worse, only older adults and others who need long-term care are targeted for these deep cuts in the governor's budget. The executive budget demands that older adults and long-term care needs bear the brunt of the Medicaid cuts. In fact, the executive budget's Medicaid scorecard shows $633 million state share reduction in Medicaid for long-term care services. The rest of the Medicaid budget only has a $112 million reduction. This is at a time when nursing homes are being paid 74 cents on the dollar for care. We've done the math. The state does not dispute this. They know that they are underfunding, yet they include no new dollars for staff in nursing homes. At the same time, we're being faced with penalties for not having enough staff. The result is my members have closed beds and closed units. That's why in the Rochester Press, as the elected officials have already noted, there were 110 patients in one hospital waiting for nursing home care. I'd just like to touch on the VAPAP program. It was interesting that the department said that it wasn't needed. The only reason it's not needed is because they haven't used it. Just in the last 3 years, there's been 11 hospitals or 11 nursing homes that have closed, 9 are not-for-profit. And this is at the same time that the hospitals are desperate to get people discharged. I'm not going to be redundant on the long-term care procurement process, but we've seen what happens when a long-term care plan goes out of business. Just one plan going out of business and the resulting difficulty in placing the people that they serve. Doing a procurement where you could have 100,000 people with disabilities being disrupted from the provider makes no sense to us. And finally, I just want to note that on the adult day health care program, as a result of the pandemic, there were 115 that we had in the state. They are now, most of them were shut down. There's only 55 that are open. In the borough of the Bronx, there is one medical adult day program operating. This is a community-based program that helps people stay out of nursing homes and is something the state needs to invest in. Thanks.
Assemblymember Jensen.
Thank you, Chairwoman. Mr. Clyne, you brought up the VAPAP program. Is the cut to VAPAP, is that included in the $200 million cut to the Medicaid long-term care?
No, that's on top of it.
So it's multiple cuts, not.
Yeah, there's a 10% cut to capital. There's a VAPAP cut, and then another $200 million on top of it.
So what, in your understanding, what's the total cut?
To long-term care, not to just, it's over $622 million state share.
Okay.
So over $1 billion cut out of long-term care.
I asked the commissioner, and I don't remember if it was the commissioner or the Medicaid director who answered the question, but in fiscal year 23, in the enacted budget, $187 million in staffing assistance was allocated. They believe that money is going out the door. For your 400 plus members in LeadingAge, is that an accurate statement?
Well, there's 3 pots of money. There was originally $120 million for staffing. None of that was spent. The next fiscal year, there was $187 million for staffing. The last bit of that money was just allocated. The next year, there was $187 million that had been appropriated the previous year. That money got wrapped into the increase to the rate last year. So that money never existed and they never spent it.
So as nursing homes are complying with the safe staffing mandates that were put in place, what is the current situation with your membership as it pertains to being able to meet those mandated numbers, kind of referencing to what Mr. Hammond said, where you see upstate nursing home employment numbers lagging behind downstate?
Yeah, if you look at the two mandates that the legislature passed. One was that we spend 70% of our funds on patient-facing care. 40% of that had to be on direct care staff. 97% of my members meet that standard, so they're meeting the 70-40. Only 44% of them can meet the 3.5-hour mandate. We are spending the money where you have told us to spend it. It's just not enough money.
So of the facilities that are meeting the 3.5, ballpark, how many are having to do it through the use of agency staff rather than their own organic staff?
Well, the ones that can pay better because they have more private pay and maybe they have a higher case mix, those are the really only two things that change the rate. They can afford to pay the staff more, so they're actually using less agency staff.
But that's ensuring that the ones that have higher Medicaid population in their census are paying a greater share,
Exactly.
but getting less reimbursement from the state.
Yeah, exactly.
And has the state done anything to alleviate the administrative burden through the HERD survey requirements?
They did a brief relief, but if you ask my members, it's not much because it's still 19 questions that give jump data to them.
Thank you.
Yeah, and just building off of that, I know the legislation, it brought a response, which is the Reimagining Long-Term Care Task Force. To date, are you aware if that task force has met?
No, I'm sorry, I'm not.
Yeah, as far as I know, that task force still has not met, and it was the purported response.
There is a long-term care panel that is meeting, though, right?
Yeah, the master plan on aging process is going through, but that has been so far an unsuccessful process, we think.
Assemblymember Joanne Simon.
There we go. Excuse me. So, Mr. Clyne, I had a question that I had asked an earlier witness. I don't know whether you heard that question, but I'll sort of repeat it. And that is the failure to increase Medicaid reimbursement rates affects both for-profit and not-for-profit nursing homes. My question is, what is that differential in impact? It seems to me it might affect the not-for-profits more significantly.
Well, I think it affects both, but I can tell you what's happened to not-for-profit and government facilities, and that's 75 of them have closed or been sold in the last 9 years. So we used to have over 250 not-for-profit and government nursing homes, and they have closed or sold to a for-profit.
And then the other question that I had asked, because about this issue about the unallocated subsidies, and I had asked why were they unallocated, and he didn't seem to have an answer for that. So my question is, do you know why they have been unallocated? Is it something in an application process that becomes a barrier, and or if you know where's the money?
Well, there's an application process, and many of my members have gone through it. Sometimes they don't hear anything and they're still waiting. And I know of some cases where applications have been not approved, including one in Rochester, which made no sense to me. We've been talking about the inability to get people discharged out of a hospital in Rochester, but the department did not want to help a not-for-profit merge with another not-for-profit in Monroe County. I don't know why. It made no sense to us. The process is very opaque. We can't really see into it. We just know members are applying and not hearing about it.
Do you get some sort of response telling you why it didn't get approved?
You get a response sometimes, but again, we have many applications that people are just waiting on, which is why it's strange they're saying they're cutting it because it's not being used, but it's not being used because they're not using it. And as I just said, 75 places have closed or been sold. You know, they could have used some of that money for that.
Do you know what the average time is before you hear back after making an application for those funds?
I don't think there is an average time. Again, it's all anecdotal. Sometimes I'll give them credit. There's a few times they've acted fast when I think they saw an emergency. Maybe they thought it was a political issue or something. But in general, it's quite a lengthy process.
I have a question for Jim and one for Lindsay. So for Jim, what would you recommend for this year's budget in order to address some of the concerns that you have talked about?
We were seeking a 2-year phase-in to fill the gap. It's $810 million. We were looking for $510 million this year. We appreciate the ad that happened last year. It was a large ad, but the reality of the market is it had a very limited impact. 400 beds came back online as a result, and you still saw places closing. One facility in Jamestown that's been serving people for over 100 years closed, or put in their application. They haven't actually closed yet. So there needs to be a substantial investment, or you're going to see more problems like you're seeing in Rochester right now, which is they can't discharge people and the ERs are backing up. I just had a relative 36 hours in an ER here in the Capital District. It's just all the facilities do not have enough the ability to discharge people.
Senator.
Thank you, Madam Chair. Mr. Clyne, in regards to the stopgap increase, this is a topic that's been coming up over the last year and really for, I think, the greater part of a decade is rebasing. And, you know, we see this push for it each year, and then we see it put out of the limelight, and then it comes up again. Does this concern you at all? Do you think this is something that we should continue to strive for? Do you think that it would be a longer term solution than just continuously fighting for an increase each year?
Well, the system should be rebased because then the money would be going to the places that have the costs. And the state, in discussions with them, they're talking about rebasing and moving to a new system of how you review the needs of the residents that we serve. The problem is you can rebase with no money. If you rebase and don't put money into the system, all you're going to do is move the money around the system. There's still going to be a giant deficit. So they need to rebase so the money goes to the right places, but they have to add money to the system. New dollars have to go in.
Would you see that as an investment that could potentially save money?
Well, it'll be matched by the federal government.
Correct.
So through the Medicaid system.
So when we talk about long-term reducing the cost and scale of Medicaid, it could potentially do so.
It'll cost a little bit more, but my members work all the time to get people out of nursing homes, and there's lots of alternatives in New York on the community-based side to get people discharged. But there is a group of people that need to have nursing home care, and it's just unavoidable. And as far as the cost of care, the one thing that we see on the nursing home side is it's expensive to do business downstate. Everything is more expensive down there, and the workforce is completely unionized. So that's the difference between us and other states on the nursing home side. If you go to some of those other states, way cheaper to do business, and they don't have a unionized workforce.
And they usually have a clause to where they rebase every 3 to 5 years.
Most states rebase every couple of years. Yes, we are definitely an outlier. We haven't rebased since 2007.
Correct. Thank you.